Hello, my name is Billy Leonardo. I'm a psychiatric mental health nurse practitioner student. I'll be doing a 10-minute video for my NU665 class from Regis College. The video will consist of a patient. My friend volunteered to be a patient. For the sake of his privacy, he will be off camera. We'll be discussing the patient's medical history, psychiatric history, and other history and physical. This story of this patient is inspired by some of my patients who are not insured and does not have health insurance and suffering from heroin abuse and substance abuse. I'll be trying to build a therapeutic alliance and establish a effective communication with the patient by maintaining a good eye contact as well as a posture leaning towards the patient and a neutral position. There it goes. Thank you. Hello, sir. My name is Billy Leonardo. I'm a psychiatric nurse practitioner. What brings you to the office and how can I help you, sir?
I'm having withdrawal symptoms from my medications and my drug addiction. My drug of choice is heroin, but right now I feel like I'm withdrawing from Suboxone that was prescribed at the hospital.
I'm sorry that you're going through all this withdrawal symptoms. Tell me more about what other symptoms you have.
So it's about 4 days since my last use, and I kind of have the allergy, like some runny nose, bacteria, nausea in the morning, a little bit after eating, then kind of a headache throughout the day, and my muscles are hurting, general body pain.
How's your experience regarding inpatient versus outpatient rehabilitation and detoxification?
I don't have insurance, so I don't have any inpatient. That's why they gave me the methadone. So I was actually used heroin for about 7 years. Tried stopping, and then they prescribed me with methadone. About 150 milligrams per day. I felt like I was building a tolerance, or it wasn't working, so I just stopped it. And then I admitted myself to the hospital where they gave me the Suboxone. But again, they kind of just prescribe, give it to me, and just kind of give me directions. But I've been cutting it in half and like extending it so it could be on longer.
Abruptly discontinuing any medication can be dangerous, but I do appreciate your motivation to, upon your sobriety and maintaining not to use heroin. How do you feel about inpatient treatment? We have resources here in the facility that can apply you for a Medicaid health insurance, and we could start you off with inpatient treatment. But for the meantime, we may have to let you know and start you off in intensive outpatient program. What do you think about that?
Yeah, as long as I get those medications where they're not just giving it to you to maintain it, or kind of like telling you what to do and then let you go.
How's your symptoms from 0 to 10? 0 not having any symptoms at all, and 10 the worst withdrawal symptoms you've ever experienced.
Currently, maybe like a 4 or 5 out of 10.
Okay. Any trigger factors or protective factors that may help you? Or
The withdrawal right now makes me kind of just want to go back to the heroin because it's more comforting. But I know like my dad just moved in Vegas here to help me out with this because he knows I'm struggling. And I have my 4-year relationship with my girlfriend. place. He's not in school and supportive of me on this trying to get sober. So some support right now.
It seems like you have some people who's willing to support you and help you get through this. It seems like your dad is very supportive as well as your girlfriend.
He seems more supportive. We have a rocky relationship.
Tell me about like your medical and psychiatric history.
I don't really have any medical history. I haven't seen a doctor or my doctor for many years. Because I don't have insurance, so it costs a lot of drugs to see them. When I was growing up, I think it started with like anxiety and stuff. I was diagnosed with ADHD, where I was prescribed Ritalin and Vyvanse for a couple of years, and then they started prescribing me Xanax, which I quickly started abusing, taking more than I needed. And then they started prescribing me Zoloft, which didn't work for my mood because I had some side effects, diarrhea, and stomach aches from that, so I stopped that too.
Tell me more about your heroin abuse, concerning the duration, the frequency, when did you start?
I started heroin when I was in high school, about 16. So it'll be about 7 years now that I've been abusing heroin. I drink alcohol maybe 2 or 3 times a week. Use marijuana recreational. I just stopped cocaine use last March, but I would spend about $60 worth of cocaine. But heroin is my go-to drug, so that's the one I use, and trying to get off that one is the hardest.
How about any traumatic history, injury, blackouts, or legal history?
No legal history. No blackouts. I know growing up, kind of got physically and verbally abused by my parents, especially my dad. They're both alcoholics, but they would only do that stuff while drinking, not while they're sober. So that's why, like I said earlier, my dad and I have a rocky relationship, but it seems like right now he is supportive and is trying to help me off this.
Okay. Seems like you're very motivated to maintain sobriety.
Yeah, this is a wicked drug. I'm tired of it. 7 years. It's consuming my life. But just the withdrawal symptoms, it makes me kind of have to go back, kind of makes me want to use. So I just need something to help with like anxiety and anxiousness and a little bit more sleep. I know I got some good sleep last night, but it's like the sleep doesn't help my anxiety.
Unfortunately, we don't have inpatient rehab, which I do recommend, and at the moment seems like it's not an option for us. So we will be, for the meantime, enrolling you to our inpatient outpatient intensive program. Our IOP is very, it requires a lot of motivation. You'll be going to the treatment, to the group therapy at least 3 times a week, a couple hours per day. You'll also be assigned to a therapist that you'll be meeting once a week for 1 hour. You'll have resources such as a social worker and case manager. We also have a state rep that will be able to help you with your Medicaid health insurance. How does that sound?
Do you have any medications that might help? Because right now I just take like Tylenol and Motrin for my muscles.
Good question. And yes, we could control some of your symptoms with, like, maybe over-the-counter medication. I would suggest ginger for like nausea. I could prescribe like Zofran to counteract your also nausea effect from symptoms. And clonidine, you have mentioned in your history that, like, your stepmom is a nurse, so clonidine is a good withdrawal symptoms, provided, like, we um, follow a strict parameters, because clonidine is a hypertensive medication and it can cause hypotension on some people, can cause dizziness, headache, fatigue, and a lot of side effects. But, like, we could like prescribe that one medication at a time. That way we know of any side effects or adverse reaction. Okay. I would like to see you in a couple days and reassess you, and I will introduce you to our case manager. That way he could work on your referral. And you have mentioned that you don't have any suicidal ideation or homicidal ideation.
No.
Good. We do have a 24-hour crisis hotline that is available for all of our patients. If you are feeling any suicidal ideation thoughts or homicidal ideation, call that number.
Okay.
Okay. Nice to meet you, sir.
Thank you.
And that concludes my 10-minute therapy. Thank you.